What is confusion? Are you confusing the confusion? Confused, right? I mean, confusion is something that we're encountering over and over again. Like here, while being on sqadia.com, you might be confused. Which course should I start with? Which topic should I watch first? However, in medical terms, confusion is the inability to think as clearly or quickly as one normally do. One may feel disoriented and have difficulty paying attention, remembering, and making decisions. A patient presents at your clinic and tells you that she is feeling unclear to what is going on around her, accompanied by disorientation, difficulty maintaining attention, loss of memory, disordered or illogical thoughts. Well, that may be an indication of a condition called confusion. Before moving forward towards the questions, you need to ask your patient. Let me tell you first, what can make confusion even worse? Well, these include head injury, recent intake of alcohol or drugs, recent end to alcohol or drug habit, recent disease, changes in environment, such as job, home, or relationships. Now, there are 4 important questions that you need to address before making a diagnosis. Firstly, you need to ask the patient or the caretaker about the changes in attention span, changes in mood or the ability to concentrate, hallucinations, lethargy or stupor, which is an alteration of consciousness marked by decreased responsiveness to environmental stimuli and absence of spontaneous movement, excessive activity, changes in sensation or the ability to move extremities, headache, fever, vomiting, and breathing trouble. Secondly, you should know if the patient or anyone in their family has had any of these conditions like chronic medical or nervous system disease, recent surgery or childbirth, alcoholism or drug abuse, history of emotional problems, or psychiatric hospitalizations. Next, you need to ask your patient about the ability to remember time, place, persons, and recent events, and you should try to speak with a person who knows him well. Now, one more important question you need to ask is about the medication history. You should ask if your patient is taking any of the medications like barbiturates, tranquilizers, antidepressants, amphetamines, steroids, atropine or belladonna, alcohol, marijuana, LSD or lysergic acid diethylamide, mescaline, cocaine, or other illicit drugs. Well, this is because the confusion might be the result of adverse drug reaction to any of these drugs. Now that the patient has done the job by telling you all they could, your main role starts here, because you have to examine the patient. Well, this physical examination includes blood pressure, pulse, temperature, breathing rate, mental status exam including orientation and simple calculations, thorough eye exam, checking neck for stiffness and thyroid enlargement, listening to the chest and heart with a stethoscope, pushing on his abdomen, rectal exam, testing stool for blood, checking limbs for swelling and discoloration, thorough skin exam, and thorough nervous system exam. Well, we can say that confusion can exist in 3 different forms: delirium, psychosis, or dementia. Now, if the patient shows symptoms like disorientation, difficulty maintaining attention, going in and out of consciousness, hyperactivity, hallucinations, may include stupor, then this might give you an indication that it's delirium. Well, delirium is a confused state resulting from underlying disease, such as alcoholism, or the sudden worsening of diseases such as diabetes, or for medications. But if your patient has typical symptoms like memory loss, inability to perform simple calculations, or changes in reflexes, then it might be an indication to dementia, including Alzheimer's disease, Pick's disease that has quite similar dementia to Alzheimer's, and senile, that means pertaining to old age, but it can also be caused by underlying brain problems. Well, dementia is actually a gradual loss of memory and intellectual function. But what if your patient is having disordered or illogical thoughts with no disorientation nor impaired intellect? Yes, Psychosis is the condition that should click your mind in such situation. Well, psychosis is in fact the loss of grip on reality, which is typical in schizophrenia and often following use of drugs, such as lysergic acid diethylamide, or LSD. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of confusion. Stay tuned to sqadia.com for more such precise and knowledge-stuffed videos.